For the history of anesthesia, anesthesia started way back in 1845 by so all these different dates here have a clinical significance if someone wants to know what kind of anesthesia was used, say before 1895 or before 1847. So only for the historic purpose these all details are mentioned. So 1845, Horace Wells started the nitrous oxide anesthesia. So this was the first anesthesia with which we started the amazing area of anesthesia, where you induce a controlled temporary loss of awareness, sedation, and for medical purpose. So nitrous oxide was first introduced in 1845. Then came ether. The following year, 1846, William Morton brought in the ether. This was again used for another year, and so 1847 Simpson brought in the chloroform, which was there for a use for a pretty longer period. Even till early 19th century, early 20th century, the chloroform was used. So that was also a clinically relevant area. So chloroform was brought in by Simpson. 1853, John Snow introduced the obstetric anesthesia. Now, this was something which was a huge clinical achievement for any doctor to bring in something which is which has a wider clinical advantage as well as wider benefits to the patients. So imagine the obstetric anesthesia before 1853 wasn't existing, meaning any female who's giving birth, who's having some kind of a procedures during the childbirth and delivery, will have to face or might have to face at that time any and all significant pain, any clinically deteriorating stages they would be directly operated on, so there will be no anesthesia. And this was a huge achievement in the medicine. Dr. John Snow brought in the obstetric anesthesia in 1853. Following 1853's obstetric anesthesia came into light 1878's endotracheal intubation. Again, as obstetric anesthesia was a huge clinical feat, same was endotracheal intubation. Endotracheal intubation made anesthesia procedures much more different than the earlier procedure. So earlier the chloroform was directly given to the patient, inhalational procedure. The patient was taken to the OT and the operation was done. But 1878 brought in the endotracheal intubation. Intubation was an important process through which, so I will be explaining endotracheal intubation a little bit more in detail. But this is one of the widely used treatment, diagnostic, as well as management procedure in the current clinical setup. So endotracheal intubation used for, as the term says, intubation. So it will be intubation of the patient for anesthesia, intubation of the patient in case if the patient is unable to breathe. With the recent COVID surges, COVID cases, endotracheal intubation was the one of the most widely used clinical uh, management skills which was needed by the doctors. So 1878 endotracheal intubation was brought in. Then 1884 came into the picture the cocaine. Yes, this is the same cocaine which is used for drug addiction. Now, this initial usage of the cocaine was for anesthesia. Later on, it was used for also, I guess, currently the Coca-Cola formula also included cocaine earlier when they started making the drink. It's a famous drink with a famous history. So 1884, cocaine was used. 1895 to 98 came into one of the greatest achievement of clinical medicine, the spinal anesthesia. Spinal anesthesia, spinal analgesia. I hope you have done the basics of medical uh, terminologies lecture series where you would know the detail of analgesia and anesthesia. So what are the differences? So analgesia is basically reducing the sensation. Anesthesia is completely knocking off the sensation. That's in basic definition difference in spinal anesthesia and spinal analgesia. So 1895 to 98 period, 3 4 different physicians they came up came up with a different procedures, and spinal anesthesia was born. This is one of the greatest achievement. As I said, this has changed the course of history of medicine, and currently spinal anesthesia is more widely used than spinal anesthesia, than endotracheal intubation or general anesthesia altogether. This is highly used technique. So that's pretty much for the history of anesthesia. Let's move on to the next one.